Hi, everyone. Welcome to our presentation, our webinar tonight, talking to you about our online medical coding certificate program. If you wouldn't mind just giving a hello in the chat box to let me know that you can hear me. I'm hoping you can. And let's see.
We got a couple of hellos, so I think everybody's hearing you fine.
Okay, wonderful. Great. Thanks for taking time out of your busy day and busy life to talk about the medical coding certificate program tonight. As I mentioned earlier, the program is entirely online at the CUNY School of Professional Studies, which is the City University of New York School of Professional Studies. So some of you may be very familiar with the School of Professional, CUNY overall. City University of New York has 24 campuses in the 5 boroughs of New York City. And some are community colleges, some are senior level colleges. The CUNY School of Professional Studies is a senior level college. So just sort of to level set where we are, and so we'll get going with the presentation. Oh, one other thing. We will be taking questions at the end, so feel free to put your questions in the question box when you think of the question. We'll be happy to try and circle back to all questions at the end, and hopefully we will have time to answer them all. But rather than forget, go ahead and put them in the question box as you think of them, and we will address them later. Thank you. So, hello, this is me. My name is Ellen Carl, and I am the academic director of our medical coding certificate program, in addition to our Bachelor of Science in Health Information Management. I've worked in HIM for a really long time, over 30 years. Most of my positions have been working in an acute care hospital and supervising or being the director of the Health Information Management Department of those organizations. In my role as the director, I always had the coding staff reporting to me. So I do know what needs to be in a medical coding certificate program. I know what coding is, and have had a lot of experience in the field. I do have an MBA with a concentration in health administration from the University of Miami, and I have a BS in health information management, which at the time it was called medical record administration, from the University of Central Florida. Right now, I am, well, I've constantly volunteered pretty much since I finished school in the HIM profession. Currently, right now, I am finishing up my 3rd year as an elected member on the AHIMA Board of Directors. So the AHIMA is the American Health Information Management Association. It's our, really, for lack of a better term, our mothership. This is the professional association to which we subscribe, and our coding program is modeled after the recommendations by AHIMA. So now I'm going to pass it over to Janet Molenhoff, and she's going to introduce herself, and we can keep going from there. Thank you.
So, hi everyone. I also have a lot of experience working in the health information management field, over 25 years. I have a master's in public administration with a concentration in healthcare from Alfred University, and I have a bachelor's in health information management from SUNY Downstate. I also am a very active member in AHIMA, as well as the state and local associations, which once you get into the field, you'll learn about those different associations. They're just wonderful opportunities to network and meet with other people. This field is very large, but in some ways it's very small. Everyone sort of knows everyone. So with all that said and our introductions, we'll just move right on to what you're here for tonight. So what is actually medical coding? It's really reviewing a medical record for information, picking out certain things, and assigning the code using the appropriate code sets. There's various code sets, and depending on if you're inpatient or outpatient, then that's really based on that you would decide which code set to use, and it's for reimbursement purposes. There's all different levels of that, and we're going to chat a little bit more about that in the upcoming slides. But the next slide shows you what you would need to study to be a coder. Many people think that it's not a very difficult job, and you kind of wonder why you need to learn all these things. But we assure you, these are the things that you need. You need these foundational courses to understand how to code. You need anatomy and physiology. You need pathophysiology and pharmacology, because you really need to know how to understand the terminology that's used in the medical record. You need to understand how the disease process works so that you can code. Also, you need to know different medications, because sometimes there might be a missing diagnosis, but there's a medication there that will clue you into why, make you question, why is this patient on this medication? There might be a diagnosis missing. There's also lots of, because this is healthcare, there are many legal issues and regulations, and you need to understand what they are, as well as ethical issues, because ethics comes up a lot with coding, because you need to be able to code ethically, meaning you should not be saying that there's some code that might get better reimbursement just because it gets better reimbursement. That documentation better actually be in that chart. So you have to be very ethical when you do your coding, and really code based on what you're reading and not what you think it should be. Computer applications is another area that you really need to know now. Many organizations, not all yet, are going electronic and using electronic health records. So you have to be able to use a computer. You need to use Excel, because that's integral to the position, to being a coder. Also, because there's so much data out there now, you need to know how to use Excel at least, and Word, and those various different common computer applications out there. And of course, the coding classification system, that's sort of a no-brainer. Of course, you need to know that if you're going to be doing coding. You also need to understand the reimbursement methodologies. There's all different types of insurance out there, and some coding rules apply to some and not to others. So you really have to understand the whole process. And lastly, what you would be studying is actually in the advanced coding and in the capstone coding course is real practical hands-on experience, where you're going to be looking at real medical records and coding from them. So once you complete this certificate, you will be eligible to sit for the CCA exam. That's the Certified Coding Associate Credentialing Exam. And then with additional hands-on experience, you'll qualify for the CCS, the Certified Coding Specialist Credential. The CCS is a highly sought after credential in the industry for inpatient coding. And as I promised you before, I was going to talk. I'm going to talk a little bit more about the different levels of coding in the next couple of slides. But for inpatient coding, that's what this program is really directed towards. That CCS is really the gold standard out there in the industry. Next slide, please. So what does a coder do? Some people have this vision that coders are going to, that as a coder you just sit at home in your pajamas and you code. Well, that might be the case eventually, but you really are working as a critical link between that care provider and the payer. So you have to look in that medical record, understand the material, code correctly, and have that bill go out the door and get paid, and have the organization get paid appropriately. It's really a lot of responsibility. You also, as I mentioned, you would review these medical records to ensure that you are coding the appropriate code assignment. Sometimes the documentation might be missing, as I mentioned before with that pharmacology portion. You would need to recognize maybe a medication that the patient was receiving, but there was no diagnosis linked to it. In that case, you would need to query or ask the physician or the provider, hey, did you miss something here? This patient is on this, says they're on this medication. So it's very important that you have good communication skills to communicate with the provider. You also sometimes might be educating providers because regulations and guidelines and reimbursement guidelines change frequently. So you might be educating the providers about what a new rule that just came down for this year or whatever. So coders are an integral part to the reimbursement or the revenue cycle team. They also often work very much alone. Yes, they interact with the providers occasionally, but it's also a very independent position. You are pretty much glued to those two computer screens. You have one maybe where the electronic health record is open, and the other you have the software that helps you do the actually complete the coding. You're sort of in the zone there with that medical record and your codes. In most instances, when you walk into the coding area in the organization, it's going to be very quiet. There's not phones ringing. There's not a lot of talking going on. It's because everybody is so intent and really concentrating. So it's a very quiet area. And occasionally there might be some discussion if you find an interesting case, or you need to talk to a colleague because you want to make sure that you're coding something correctly. But on a whole, it's a very, very quiet area and a lot of independent work. Okay, next slide, please. So what are the career options for a CCA or CCS? So here's where I'm going to talk about the different levels of coding. The inpatient coder is really the top dog. They are the ones that make the most money out of all the different coders. You might, there's physician coding, where I'm sure if you've gone to visit your physician, there's somebody there that often does what they might call coding and billing. That's sort of a low level, very low level coding. You don't really have to have a tremendous amount of knowledge to do that. In the hospital arena, the sort of lower level coding would be in the ER, in the emergency room. Maybe you have a few pieces of documentation to review, not a whole lot. Maybe some maybe an X-ray, a radiology report, and lab report, and one other paper that the provider documented. It's not a lot of paper, information to review. The next level coder would be the outpatient coder. This is the area that might code ambulatory surgeries. There's a little, much more documentation than the ER area. But this, I would, in the hospital setting, is sort of the mid-level coder. And then lastly is that inpatient coder. There's a lot of documentation to review. You have to have a lot of knowledge about anatomy and physiology and all of that. So that's sort of the top one, and that's the one where you have that CCS credential. So some of those, another title you might see out there is medical coder, and that's sort of broad and doesn't really specify what they are. But as I mentioned, for the hospital area, those are those three levels. So those are sort of the starting levels. Then with more experience, you might become a remote coder. That's the coder that's working from home in their pajamas, as I mentioned, but it's really quite challenging. It's not as many people think that it's such a cushy job. You're obligated to be at that computer for the designated time frame. And it's not something that you just walk right into right out of getting that CCS credential and then right into remote coding. Most organizations want you to work on site for a period of time to ensure that your productivity and your accuracy is at a certain level, and then they allow you to work remotely. If your productivity or accuracy dips down a little bit, they might require you to come back on site to do coding. So there's a lot of restrictions with that, and it's not like you can code from home while you're if you have a younger child and you can babysit the child, be watching the child and coding. Most coders that work from home have a separate area in their house, and when they're working from home, that is where they're working. So it's people's perception of what working from home is and working as a remote coder is a lot different from sometimes the reality. So also the next higher level with experience is the clinical documentation improvement specialist. These are people that are out on the units, working with the providers, making sure that the documentation is appropriate as the information is flowing right on with that patient on the unit. They're working in real time with this clinical provider to ensure that the documentation is there, so when coding occurs that everything is there and we don't need to go back and query the physician. Because that takes time and we don't want that. The DRG validator is someone that verifies that all the coding was done appropriately. And then the revenue cycle auditor. So these are, like I said, some of the coding titles that you might see out there. On the bottom, there is a link for HI careers, and on there you can see a career map that sort of gives you an overview of some of the things that I've said about what an entry-level position looks like and what more of the advanced positions look like, and what skill sets that you need to get to those advanced levels. So it's a nice little website to visit to get some more information. I'm going to hand this over to Ellen now, and she's going to talk a little bit more specifically about the program here at SPS.
Thanks, Janet. So what are the requirements here in order to start the medical coding certificate? So we do require that you have a high school diploma or equivalent. We also do require reading and writing proficiency, and there's a few ways that you can earn that reading writing proficiency. If by chance you've already taken a college level English course, that would qualify. There are also certain qualifications if you live in New York State and took the New York State English Regents exam and got a certain score, that would qualify, as well as scores on an SAT exam. All of this is on our program page, but if you have any questions whatsoever about it, we'd be happy to answer them, or the folks in admissions could answer. This is a really long certificate program as certificate programs go. There are 36 credits in this program. There are that means 12 courses. Each of them are 3 credits. So it's 36 academic credits. So you would be earning college credit for these courses that would be fully transferable to any other college. And the nice thing about this at the CUNY School of Professional Studies is that we designed this so that all 36 credits you could then roll into the BS in Health Information Management if you wanted to continue on and get that bachelor's degree. So what does it take to be an online student? I'm sure some of you have already had some experience with learning management systems. at the CUNY School of Professional Studies, and actually all of CUNY uses the Blackboard platform. It's a very common platform used in many, many colleges across the country. That is the one that we do use. I guess the most important thing, these first two bullets here on the screen, time management and discipline. Those are the things that are going to make a difference between you being successful as an online student or not. We really suggest that you carve out time in your schedule and put it on your calendar that you're going to study this particular course on this night and this on this night. And on the weekend, you're going to put aside time to take care of your coursework. We say that at each course that you take at CUNY School of Professional Studies, you can expect to spend between 9 and 12 hours a week on each course. So let's just average that out to 10. So you can see pretty quickly, if you're taking 2 classes, you have another part-time job. You need to dedicate 20 hours out of your week toward taking those classes. And so, as time management and discipline really do go hand in hand. As far as Blackboard is concerned, if you do enroll, there is this short orientation that we do have all students do, sort of to get you familiar with the platform if you're not familiar with it, and how to submit an assignment, how to write on a discussion board, etc. But a little bit more about that in a second. So this is what the inside of an online course looks like. This is one of our actual courses. And if you look at the top left-hand corner there, you'll see that it says 2017 Fall Term Introduction to Health Information Management. So this is actually one of our courses. And the menu down the left-hand side of the screen here is really the menu that pops up in all of your courses. And the items listed here are pretty standard throughout all of your coursework. There'll be announcements, and this is the announcement page. If your faculty member had an announcement to push out to you, you would see it here. The Start Here tab, if you want, for lack of a better term, you click on the word Start Here, and that's what you do the very first day or week you're starting class to make sure you're familiar with everything you need to do. You have a syllabus here that's posted here that you can go back to and refer to anytime you want. The next one is weekly folders, and this is where you're going to go most of the time to complete your work. There's discussion boards, and being an online student, the big thing that's different between being an online student and a face-to-face student is the discussion board. As you know, if you're sitting in a classroom, you may have discussion in your classroom with your faculty member. In an online course, you must post on the discussion board instead. There's going to be items, there's going to be prompts that make you think, and sometimes they are opinions, just like in your course. If you were in a face-to-face course, the faculty member might be, prompting you to think about a particular issue or topic. So you post in the discussion board. So in an online class, you really can't hide. You remember in those face-to-face classes you had, whether it be in high school or in college, and there were those group of students that sat in the back of the classroom and, were sleeping on their desk. Sometimes the teachers didn't let them do that, but yeah, they're sort of, zoned out in the back of the classroom. Well, you can't hide in an online class. If you want to get points, you need to participate. So, and I do think that oftentimes the faculty members get to know their students a lot better in an online class, believe it or not. So continuing down with the menu bar, there's a place where you submit assignments, you can check your grades, frequently asked questions, how to contact your professor, and we also have a link here even to AHIMA, the American Health Information Management Association. So this next screen is clicking down into the weekly folder item. I'll go back for a second. If you look on this screen about midway down, it says weekly folders. So when we click into that, this is what we see. So this was, let's see, I don't know what week it is, but it just says this is what you have to work on during that particular week. You're going to talk about the evolution of patient medical record, and here are the learning outcomes. This is the reading and the things that you have to do. In addition, there's a discussion board that you have to complete. Everything is laid out here so that you know for that given week what you have to do. And just to clarify a little bit about that, in online classes, this is not a self-paced course at all. All of our online classes at the CUNY School of Professional Studies are rigorous courses. There are due dates, usually at the end of every single week. Your week could end on a Friday or it could end on a Tuesday. So if your quote unquote week here in the weekly folder might start on a Wednesday, you have 7 full days until Tuesday night at midnight to submit all of your work. So you have to pace yourself and you have to put it on your calendar and make sure you're getting all of the assignments done as you go along. So in this particular week, you know, all of these things must be done by the end of the week. And then the next day, a new week starts. So you have really 1 week, everything is a module of a week. You can do that. We don't care when you do your work. You can, if you work the evening shift and it's easier for you to get your work done at 3 a.m., there's no limitation. Blackboard is always open. It's always available. You can do anything in Blackboard at any time during the week. So there are no limitations. It's why it's great for folks who are working full-time already. So why should you choose the CUNY School of Professional Studies for this coding certificate? Well, we are part of the City University of New York, as I described to you before, our 24 campuses. There's lots of opportunities for growth and upward mobility, upgrading of knowledge. We are regionally accredited by Middle States Commission on Higher Ed. And this is a really important distinction that I want to make to you. If you are shopping around for programs, it is really important that you determine what level of accreditation the school has that you are looking at. Middle States is the commission that's in charge here in the Middle States and of this area of the country. There are 5 regionally accreditation bodies throughout the United States, and they break up the country in those 5 different parts. The important thing here is, as I mentioned earlier, you will be earning academic credit. If you want your credits to be transferred to another program, say you wanted to go and do some other different kind of program, not within the CUNY system, and you apply for, you know, say a bachelor's degree elsewhere, you want to make sure that any coursework you're taking is fully transferable. If you go to a college that's regionally accredited, you are ensuring that your credits are fully transferable. In addition, they could be used for consideration if you're going to go on for a master's degree. This is a really, really important distinction. So please, no matter where you go, no matter what you do, make sure that your credits that you're receiving are from a regionally accredited college. And last bullet on this slide is that we have been, now this doesn't affect you so much because this is not, we're talking about a certificate. However, all of the courses in this medical coding certificate are also part of our bachelor's degree program. So we were ranked 16th for the bachelor's degree programs by US News and World Report. We're pretty proud of that. So who are our students? Well, we've done some studies, and actually our students are probably the average age of 34. Our students are, the majority are female. Many of our students are working adults. Some are in career transition. Many of our students have families of their own and really need some sort of degree or program that fits their schedule. And we do have people from 50 states and from all around the world. So it's a really nice mix of folks. But we are, as the School of Professional Studies, we are geared toward the adult learner. And who are our faculty? Well, this happens to be Janet myself. Janet is laughing a lot here in this picture, and I'm just standing by with my beige color purse. So this is us, but we have experienced CUNY faculty, many of whom have the credentials from AHEMA, indicating that they are very knowledgeable in the field of HIM and medical coding. Very knowledgeable practitioners. All of our other adjuncts are out working other full-time jobs in the field. And they're all skilled at teaching online. We do have them go through an orientation to how to teach online. So as far as student services are concerned, you will have one advisor from the time you start the program, from the start to the finish. We do have tutoring, both online and in person. We have a library that's both online and in person, but the library can be accessed 24/7. And believe me, I've tried it out one time. It was Saturday night and I was trying to do something, and lo and behold, the librarian answered the line when I called. So it's a really nice feature. It's actually some sort of cooperative between colleges across the country, and so that there's always somebody manning the phones. And we have a help desk that helps students with any sort of your technical issues. So here's some frequently asked questions. And can you really earn your certificate online? Well, absolutely, positively, yes. Is your school accredited? Now, I already mentioned this, but we are accredited by middle states, and that's the most important thing. And how long will it take to get my certificate? Well, with this program, as I mentioned, it's 36 credits. Because we have a series of prereqs upon prereqs upon prereqs, the usual amount of time to get through this program is about 18 months to do it the right way. And what do you need to be accepted into the program? Well, we did talk about that earlier. You need a high school diploma or equivalent, and you do need to have that proficiency in English and writing. Let me see what else. So here's my contact information and also the contact information for our Director of Admissions, Lucas Fuentes. Either of us will be happy to answer any questions that you might have. I know one question that comes up frequently is financial aid. Because this is a certificate program, there is limited financial aid available in terms of grants. However, there is if you are a member of a union, you might be able to take advantage of your union benefits. Usually, at least some of the unions in the New York City area and elsewhere, if it's 1199 Healthcare Workers Union, they will pay for 2 courses per semester, which is a wonderful benefit. So, or your employer might, if you're not a member of a union, your employer might have some additional benefits that they could offer to you as far as financial aid is concerned. So, Janet, I don't know if did I miss anything?
No, I think you covered everything, but we do have a few questions.
Okay.
Well, the first question I need the person to clarify a little bit. They're asking about job placement ratio in New York City for students who hold this certificate. I'm not sure what they mean by that. Are they talking about the coding certificate, the CCS? I mean, I don't know that we can answer that question,
Right.
or if they could clarify a little bit.
Let's just take a step back on that. This is a relatively new program, probably about 18 months old, which means, of course, since I told you it takes 18 months to finish, we're coming up on having 1 or 2 students finish. So we really haven't had students finish the program and go on to be employed just yet. I'm sure we will in the future if that's the kind of information you're looking for, but we don't have that kind of information available just yet.
Okay. So someone else would like to know, is the CCS similar to the CPC credential?
No, it is not. The CCS is an inpatient coding credential, as Janet mentioned. It really is the gold standard for inpatient coders. And as we said, this is what all employers are looking for inpatient coders. The CPC is very much an outpatient-based credential, which is, as Janet mentioned, 3 levels of coding. Outpatient and doctor's office, that's really the lowest level of coding, and that's what the CPC is really training folks for.
Will we learn Epic and other hospital software, such as the latest version of computer-assisted coding software?
Well, those are 2 different things. So Epic is an electronic health record system, and no, we don't have access to Epic. Epic is very proprietary and does not allow training facilities to have access to their software. So no, you won't have access to Epic. We do have access to an encoder, which is what is used in a health information management department to help and guide you to code. However, first and foremost, everyone learns how to code using books. This is very important that you learn how to code using books before you move on to use some of the encoder software. One of the most popular encoders that's used in HIM departments is 3M. And 3M just recently has a CAC product. We don't have access to that just yet, but we have access to these products through the AHIMA virtual lab. So it's a virtual type experience.
And also, Meditech is the EHR, one of the EHRs that you'll be exposed to, electronic health records that you'll be exposed to in that VLab.
Right.
I'm going to combine these 2 questions. What is the tuition, and what about the cost of books?
Okay, so tuition, because this is an undergraduate certificate, the tuition is the same as the CUNY undergraduate tuition. So right now it's $285 per credit. If you are an out-of-state student, because this program is online, it qualifies for in-state tuition. So it's $285 per credit times your 36 credits. So it's about $10,000 altogether. And what was the other part of the question?
The books, cost of books.
Oh, books. Yeah, the books can get a little pricey because those code books can be very pricey. They are not included in the price of the tuition.
We do also try to use AHIMA books, a lot of AHIMA books. So if you become a student member to AHIMA for $45 a year, you do get quite a good cost savings.
Right.
Just want to throw that out there. When is the next session?
Well, this isn't done as a cohort, so you can go as fast or as slow as you would like with this program. So it's not like you're going to see the same people in your course at the same time. Because as I also mentioned, our HIM program also has, you're sharing classes with our HIM students. We do have the fall semester coming up. That would be the next start really for the folks in the medical coding certificate program. The semesters are typical 15-week semester, and occasionally we do offer courses in the summer. I'm just trying to think for this program. We have run some courses in the summer for the medical coding certificate program. So there would be the opportunity to maybe take a course in the summer just to sort of propel you forward.
Are some programs nationally accredited, or is regional accredited the norm for this program?
Regional accreditation is the norm for colleges. National accreditation, not quite sure what, there are some other accrediting bodies out there, but I would be very careful if you are going to something other than a regionally accredited body. There are some out there that say they're national accreditation organizations. I'm not sure if you went to a nationally accredited organization that your credits would be fully transferable somewhere else. Just be really careful about it.
Okay. Will we be using ICD-9 or ICD-10 as well as the medical manager programs in our courses?
No ICD-9, only ICD-10. We use ICD-10 CM, ICD-10 PCS, which is the procedure coding system. That procedure coding system, is what is used in the inpatient coding arena. You need to know that in order to be a good inpatient coder. And then we do use CPT, which is used in the outpatient environment.
Okay. This person has studied outside the U.S. and they have studied English. Do I need to take a test to qualify for this course? Please advise.
I'm not really sure. I think it depends on where it was and other details, but you could email Lucas Fuentes, whose email is on the screen here, and he would be the best person to advise you properly.
Okay, I have a BA in science and currently working in a hospital. What do I need to submit to get into this program?
Your transcript. I'm sure you have an English class, or you'll be exempt from the English class because you already have a BA. But that's what you would need to do. You could go to our website, which is sps.cuny.edu up here on the screen. Look for the certificate programs. You can find the information about the medical coding certificate program, and then it'll direct you to where you can then apply.
I don't know I can't remember if you mentioned also part of the admission application is you have to write a brief essay too.
Right.
Okay.
Right.
Will this course prepare students for CCS or CPC?
Well, the ultimate goal for any coder is to get that CCS credential. However, if you do some research and you look into the CCS credential, at HEMA, who are the folks who offer the credential, it really says that you need several years of coding day in and day out for a couple of years before you're proficient enough to be successful on that CCS exam. So if you're coming into this program, you're not, unless you have some experience already, it'd be very difficult to finish this program and jump right into that CCS exam and be successful. That's why on one of the other slides we said you would definitely be successful on the CCA exam. You would probably be successful on the CPC exam when you finish this program. But it would be difficult to be successful on the CCS exam coming right out of this program without hands-on coding experience.
Okay, I believe you answered this, but I don't think it hurts to go over it again. Can we receive financial aid for this course?
Yeah, so no, there isn't a lot of financial aid available for this program. The best thing to do is if you're employed at a healthcare organization or elsewhere, or if you have a union affiliation, check into what benefits you might have there. That would be my best advice to you. You can get loans for this program, but there are very limited amount of grant money available.
Are there internships available to get hands-on experience?
Possibly. We have a virtual practicum capstone course that we are using real records in in our program in Blackboard. However, what has happened in the industry is that many coders work at home. Many healthcare organizations are very protective of their information due to HIPAA. So they do not allow a lot of students to come in to their organization to actually have access and logins to all of their systems. So that's a problem. And in addition, the other problem is that a lot of coders work from home. So you can't go to the coder's home. I'm very sorry to do an hands-on experience. So most organizations are going to a virtual experience for this.
Okay, I don't really see any other questions coming in.
Okay, we'll give it another minute or so, and if there's no other questions, we can sign off for the evening. But feel free to contact us. For instance, if you have any questions about if you've had prior college, for instance, the person with the BA in science, I don't know, maybe you took anatomy and physiology at some point. There is some transfer credit available for if it certainly fits into our coursework. So if you have any questions about that whatsoever, email me or email Lucas, and between the two of us, we'll be able to answer your questions.
I think that's about it.
Okay. Well, thanks again, everybody, for taking the time out of your busy schedule and busy life to join us tonight to talk about our medical coding certificate program. If you do have any questions, feel free to reach out to me, and we'll be happy to answer them. And maybe we'll see your application in the portal. So thanks again, and have a great evening.